Within communities of color, mental health isn't really talked about. It's very stigmatized.
A lot of people feel lack of support from their own family or friends, or may feel that they can't go to them.
Ever since I was younger, I've struggled with a lot of mental health issues and not really been informed about how to go about it.
I had told many practitioners that I felt like the diagnosis that I had was not accurate. Nobody was listening to me.
I kind of had a mental health practitioner that I would go to often. It just doesn't seem like they're understanding me.
Even though I was very forthcoming and they always told me that I seemed like a very well-spoken person who knew what was wrong with her, but they didn't know how to deal with me or how to get me the care that I needed.
The commonality of having to be persistent and continuously vocalizing your need to the practitioners more than you have to.
I know that other Black people and other people of color have gone through the same thing because I've experienced it myself.
I think trauma-informed care is very important, especially in BIPOC communities.
Being a trauma-informed organization takes more than just knowing that the young people that you work with have experienced trauma.
Race, income, where you grew up, that all impacts your mental health. That all should be taken into account.
I just wish that they would listen more and ask questions that would help me get to the root of my problems.
I think they have the experience, but they don't have the knowledge. You can have experiences working with these people, but whether or not you gained anything from that experience is what matters, and I don't think that has happened enough.
I feel like if people had a better space and a safer space to really speak on what they're going through, then their treatment plan would be a lot better.
Make sure that you are listening to the person who is seeking care from you.
They know themselves and what they've been through more than anybody else will.
Involving community as well as family, I think that's also a big thing.
Have equity specialists coming in and having maybe monthly trainings and stuff on that.
This is hard work, and I know that you are committed to it. So thank you for your time, and please keep having these hard conversations.